Kidney disease in sub-Saharan Africa is estimated to be 10% and 13% of the population. In Uganda, the prevalence of acute kidney disease in the community ranges from 2% to 7% and up to 15% among patients with HIV or hypertension. Kidney disease in Uganda is increasing and is among the top 10 causes of death. Today, as the world commemorates World Kidney Day, Mengo Hospital, in partnership with Rotary Club Kampala South, have taken the initiative to create awareness about kidney disease.
Rotary Club of Kampala South partnered with the Mengo Hospital, and we have a couple of international partners who have joined us on this project. The dialysis project was launched in 2022, and we give special thanks and recognition to the partners we have. Some are not in Uganda, they're in different continents, and we really take time to appreciate and recognize them. As Kampala South, we have a number of projects, but we specifically picked interest in the dialysis project because this was one of the biting challenges in the community. And also, when we looked around through a feasibility, we realized that these services were not readily available or affordable. So that's why we reached out to Mengo to identify ways we can support and our communities and also those people in need. Specifically,
the World Kidney Day, and the theme is kidney health for all. Why do we emphasize kidney health for all? As doctors, the oath that we take on is to, spread our services out and benefit each and everyone, irrespective of race, sex, age, color, and ethnicity. And we believe, or we think, that as a doctor, my area of influence is small, and yet media and many other partners have a bigger influence in people. So I just want to give you just a small background about kidney disease. Now, worldwide kidney disease is ranked as one of the top 10 causes of death. You realize the world is now coming to how many billion people? About almost 8 billion people. And sub-Saharan Africa accounts for about 1.18 billion people. Of those 1.8 billion people, between 2 to 7% of that population has kidney disease. That's talking about 248 million people with kidney disease. And that's a big number. Those of you who know the kidney is an important structure in your body that plays many roles. It's one of the organs that you cannot survive without. You can survive with one kidney, praying to God that one kidney functions until He calls you. But it's an important structure, so much so that it controls almost everything in the body.
According to Dr. Ezra, poor health lifestyles like too much drinking, low intake of water, diseases like diabetes, high blood pressure cause kidney disease.
There is a problem either before the kidney, like patients who bleed, mothers who bleed in the ward and lose a lot of blood. The kidneys not get enough blood, so they start dying. Or maybe patients who have accidents, or children or babies who have diarrhea and lose a lot of water, or children or people who have malaria that deposits bad things in that mesh. So the mesh that was supposed to be so tight becomes bigger and is not sieving enough. So even the things that you need are going through, the kidney starts to die. So it starts to lose its ability to function.
Most patients on dialysis have poor quality of lifestyle because they are very numeric and often under-dialyzed because of cost and availability. Doctor explains the importance of dialysis.
It takes over the function of the kidneys. Sometimes your kidney has just been shocked that you've got a small condition and it's not able to work. That's what we call acute kidney injury. Such that you need something to stand in for the kidneys as this kidney is given time to recover. But these patients are placed on the hemodialysis machine, which is going to keep cleaning the blood. So blood comes out of the patient, goes through the dialysis machine, and the clean blood comes back to the patient. These are cycles that run for between 4 to 6 hours. And a patient in the start might need between 3 sessions a week, and as the kidney function improves, then the fewer sessions. That is what we call intermittent hemodialysis.
People are advised to keep a healthy body free of diseases.
Kidney disease. Take care of your kidneys. Number one, drink enough water. Avoid poisonous chemicals like this cheap alcohol, the Buveras. They will kill your kidneys. I can tell you with certainty, and I wish the media to send this message out to the people. Please avoid this cheap alcohol, and if you can, modulate the amount of alcohol you drink. As a doctor, I'm only there to tell you what to do, but if you don't do it, I'll wait for you to come as a patient. I have nothing to do. So it's up to you. The government doesn't have money to pay for your dialysis sessions. So if you don't, like Bobby Wine says these days, you will die.
In partnership with Rotary Club Kampala South, Mengo Hospital is organizing a treatment kidney checkup. Therefore, people with high risk factors are encouraged to seize the opportunity.
Tomorrow, we shall, and in conjunction, I want to thank the Rotary Club of Kampala South. With them, we have organized a session tomorrow. All those who have high blood pressure, all those with diabetes, please check your kidney function. And Mengo has still, together of course, Rotary Club Kampala South has become part of Mengo Hospital. It's part of Mengo Hospital. Together with them, we've been able to subsidize the price of renal function tests to 38,000. From 50,000 to 38,000. But we shall have free consultations on kidney health. We shall have free medicine for high blood pressure. We have partners who have given us medicine for this medication. You'll be checking and asking questions. How do I protect my kidneys? How do I keep my kidneys healthy? So please, come tomorrow 8 a.m. Those who have high blood pressure and diabetes, please come, let's have that session.
International partners and Uganda government are encouraged to join together to help Uganda improve prevention and care for kidney disease.
Over the 120,000 dialysis sessions we should be doing a month, we can only do 441 sessions per week. And the funny thing is that men are more affected than women in all statistics. So this calls for collaboration from many partners. Rotary has done its work and continues to do its work, but the media, the government, you as individuals, as opinion leaders, as political leaders, we need to prevent kidney disease. Because I don't know whether any of you can afford to churn out $200. That's like $600 every week. So the advice is, let's prevent these conditions that cause.
Developing countries such as Uganda face challenges in developing these services, yet they bear a large burden of advancing kidney disease because of lack of access of preventive measures. World Kidney Day is a day started by an International Society of Nephrology and International Federation of Kidney Federation, a day that is observed every year since 2006 and is significant as it provides for advocacy of good kidney health for all. Anselm Ojaru, live at 8.
Kyasinze okuleeta obulwadde bw'ensigo gwe musujja gwa malaria